My name is Marc Feldstein. I'm an attending physician in the Department of Obstetrics and Gynecology at Northwestern Memorial Hospital. I like practicing OBGYN, I like seeing patients, but at the same time I also like being able to teach and be involved in the medical teaching mission of Northwestern.
Marc has assumed a very important role, not just in teaching at the bedside. He invites students into his clinical practice so that they can not just observe him, but also participate in the care of his patients in a very authentic and important way.
Medicine involves lifelong learning. Once they're done with residency and working, no one is going to be giving them quizzes saying, have you studied, have you read this, have you read that? So we're trying to inculcate that as a part of our problem-based learning curriculum, so the students leave learning how to find the resources to get the information they need to take care of their patients.
Marc Feldstein is a contributed services faculty member. They're faculty in private practices who donate their time to teach our medical students, residents, and fellows.
What I emphasize with them is that this teaching model, taking the history of physical, assessing labs, radiology, and so forth, that's a formula that works in no matter what department you're in. If you're in the ICU or general surgery, internal medicine, I want them to leave with a template that they can use, and no matter what specialty they go into.
It's not easy to get out of the clinic and spend time teaching. The core faculty program is a program that was developed by the Feinberg School of Medicine, and Northwestern Memorial Hospital has helped funding this program, which provides a stipend to the core faculty member to free up their time from the clinics so that they can spend more time teaching.
We can relieve them of their patient care duties or their lab-based duties and bring them into the learning environment of the student, unburdened by the need to see patients and generate income, and take them and devote them fully to the observation and skill development of a student.
I can spend up to 30 minutes with each medical student, which is really one-on-one. That's a phenomenal amount of time. And I start off by just watching the student. I say nothing. I just sit there like a bug on the wall and I watch the student interview the patient, take the history, do the physical, assess the labs. We then leave the room. The student talks to me. We sort of do a presentation. And then at the end, when I've met with all of the students for the day, we all get together in a small group with each person again presenting, going through assessment and plan. And this really is a great educational experience because the students get feedback, they get to hear the mistakes the other person made, the questions one student has, you can be sure another student's going to have that same question, so it's really an excellent experience and they've been very happy with that. I'm very lucky to be at Northwestern because it's a commitment to education here from the top down. They're really emphasizing medical student education and they're really trying to get attending physicians involved, not just resident teaching. This is full attending physicians involved in the teaching here. My hopes for my students is that they practice excellent medicine and that they always remember their time at Northwestern Medical School, and hopefully also that they remember that I was involved in their education. They remember me as a part of that educational process.